Hello everyone. Welcome to District Endocrine. This is Dr. Rahman, and today we are going to talk about thyroid nodules. Let's get into it. So, thyroid gland is a small gland which is located in the base of your neck. It may or it may have nodules which can be either solid or fluid filled lumps which may or may not be palpated with your fingers. Now, several of these nodules are mostly asymptomatic and are found incidentally when a person goes to any doctor's checkup visit or they are undergoing any radiographic imaging. Some of these thyroid nodules may be large enough to be visible and may also affect swallowing or breathing because of the pressure in the neighboring areas, neighboring structures. When do you see a doctor? Well, as I said, up to 15% of these thyroid nodules can be cancerous. So it is important that if you feel that you have something in your neck or you have a thyroid nodule, which may be found incidentally or during any imaging, it's important to talk to your doctor and possibly visit an endocrinologist who is a thyroid specialist, and they will offer you thyroid fine needle aspiration biopsy to see if there is any cancers in these thyroid nodules. If you're feeling that you do have signs and symptoms of excessive production of thyroid hormones such as hyperthyroidism, or if you have underproduction such as hypothyroidism, in that case you should definitely see a physician. Sudden weight loss, pounding heart, trouble sleeping, muscle weakness, nervousness, irritability, or mood issues can also be from thyroid nodules, or if there is any functional issues with the thyroid. In some cases, when thyroid is not producing enough thyroid hormone, the thyroid can be enlarged. For example, if there is continuous chronic iodine deficiency for an extended period of time. So that is that there is underproduction of thyroid, and patients can present with several symptoms such as feeling cold, fatigue, depression, constipation, low mood, low energy, dry skin, and memory problems. Overgrowth of normal thyroid tissue. Most commonly, we see that the thyroid glands, that there could be overgrowth of normal thyroid tissue, which are mostly not cancerous. However, these nodules mostly do not produce excessive amount of thyroid hormone. However, sometimes they can actually do that, and that can lead to a condition called hyperthyroidism, specifically toxic thyroid nodular disease. Thyroid cysts are usually non-cancerous. They sometimes can contain cancerous cells if there is a solid component next to them. So these fluid-filled cavities or cysts are maybe direct result of degenerating thyroid nodules, and if they are very huge, may need aspiration to decompress them. Chronic inflammation of thyroid such as Hashimoto's disease, which is an autoimmune inflammatory condition, can lead to excessive thyroid inflammation, and that can lead to enlarged thyroid gland. In some cases, it can show up as thyroid nodules. Now, these are called pseudothyroid nodules because they are not actual real thyroid nodules. And you may need to have a good look at the ultrasound to make sure what kind of nodules you have. Multinodular goiter is basically a term used when there are more than one thyroid nodule present, and they can be from iron deficiency or just from thyroid disorders. And the etiology of this particular condition is not very clear. There there are certain factors that can actually increase your risk of having thyroid cancer, and in these thyroid nodules, such as if there is a family history of thyroid cancer, if you have exposed to radiation, that could be because of some medical treatment or a nuclear fallout in your area. Patients who smoke cigarettes have an increased risk of thyroid cancer. So if you smoke cigarettes, you definitely want to work on trying to cut back and then finally stop smoking basically. lack of iodine in the diet, specifically in some parts of the world, there is an associated risk of thyroid nodules. Luckily, in the US, most of the food is iodinized, so the risk is very low. In terms of the complications associated with these thyroid nodules, the first thing to talk about is dysphagia. Dysphagia means patients have difficulty swallowing fluids or solid food due to the compressing effect on the food pipe from these thyroid nodules. Dysphonia is a terminology used when some people cannot they have increased thyroid nodule size that is compressing the windpipe, and that is causing difficulty breathing and can lead to shortness of breath. Hyperthyroidism is when these thyroid nodules are overactive, and if these nodules are left untreated, that can lead to thyrotoxicosis crisis and can eventually manifest with life-threatening thyroid syndrome that needs to be treated in an ICU setting. Thank you so much for watching another episode of District Endocrine. This is Dr. Rahman signing off. Please don't forget to visit our website www.districtendocrine.com. And a disclaimer, there is no sponsorship or any conflict of interest for this particular video. Don't forget to like, subscribe, and share. Thank you very much.